All right, here we are. Hi, Kim.
Hi.
um, yeah, thank you so much for being here. Today is May 12th, so that means we are on the 12th day of the mouth breathing awareness campaign that I created really just to get information out there about myofunctional therapy. A lot of people don't realize how mouth breathing is such like a red flag symptom that can show us that there's so much more going on in both kids and adults. And it's connected to tongue tie, it's connected to sleep apnea, it's connected to facial growth and development in kids and so much more. So thanks for being here, Kim. I'm just going to give you a
Thanks for
little,
having me.
yeah, I'll give you a little introduction and then I want you to delve into your story because I know it's a good one. And I think a lot of what you've gone through will help patients a ton. So
Sure.
um, this is Kim Kung, and she practices just outside of Toronto. So she's a myofunctional therapist and dental hygienist in Waterloo, Ontario. And your practice is face forward,
Mhm.
and you see people online and in person. Once things open back up, you can do that again.
That's
Um,
right.
and I know you've also had myofunctional symptoms yourself. And so I would love if you can just share kind of how you got into the field, how you figured out that you needed the therapy. And I'm in the same boat as you, so don't, feel weird about it. But yeah, take it away.
Great. Yeah, thank you. I think this is probably the first time that I've ever shared my story on
Oh, really?
video or
Oh,
publicly. I think probably many of my clients and
yeah.
anybody else that would kind of know me knows my backstory and how I got into this. But I'm super excited to share it with everybody. And I almost felt like it was embarrassing at first, but I think just like what you said, sharing my story hopefully will help other people. So um, I feel like my story's long and kind of like a sad
Don't worry at all.
story, but with a happy ending.
Yeah,
So
no, we'll go back and forth too. And if I want you to elaborate on anything, I'll just butt in. So,
sure, sure. So um, I guess like kind of going back a little bit, I definitely had myofunctional disorder symptoms my entire
when you were
life.
a kid, yeah.
Oh yeah.
What did you notice? Like, what would people like
I,
or relate to, I guess?
so I guess like as a child, I wasn't aware of anything. My
Yeah.
parents were, but looking back at pictures, even when I was a toddler or a young kid, I had a huge open bite. Um,
Mm.
and every smile that I had this great big open bite, but um, I never sucked my thumb. I never had a soother. So by the time that I was probably like 8 or 9 years old and went to see an orthodontist for the first time, um, they were kind of blown away by why I had this big open bite. They couldn't really figure it out, and they kept saying to my parents, "Well, she must have sucked her thumb." And they said, "No, she never sucked her thumb."
It probably
Um,
made you like self-conscious from a young age too. I mean, I was a pretty shy, self-conscious kid, and that would have just been horrifying.
yeah,
Like to have all these adults like, "What's wrong with her teeth?"
yeah,
So,
yeah. So now knowing what I know and looking back on my childhood, I had chronic allergies. I was always stuffed up. I breathed through my mouth all the time. Um, if there was ever a picture of me that was not a smiling picture, my mouth was open. Um, and I remember actually like my parents saying to me, "Kim, close your mouth. Kim, close your mouth." So they were
interesting.
aware of that.
Yeah.
But I would try to close my mouth and I would say, "But I can't breathe. I can't breathe if I close my
Mm,
mouth." So I kind of just went through my entire life thinking that I could not breathe through my nose. So I had to breathe through my mouth.
wow.
Um, Unfortunately, now knowing what I know, I think it was all of those mouth breathing issues, the open mouth, tongue probably resting between my teeth all of the time, that
Yeah.
had actually created my open bite to begin with, and all of the dental and orthodontic problems that I went through. So
Yeah. Did they actually put braces on you? Like I know they were looking at your bite dip, but when you were like 8, 9, did you get braces then?
So I actually had a palate expander when I was 9.
Mm.
Um, and then When that was removed, I had a tongue thrust appliance.
Mm.
Um, and when that was removed, actually, it was a removable appliance, and I don't actually think I wore it very often
Oh my gosh.
because I struggled to breathe when I had the tongue thrust appliance in. And that probably made me open my mouth more.
It's so
Um,
crazy. Really quick, did anybody ever say like maybe you should get allergy tested, or did anybody
no,
ask about
never.
your breathing? That's so
Never.
crazy. Oh
No,
my gosh.
no. So I hope that now there's so much more awareness that now if we see a kid like that, we will automatically think, how is this child breathing?
Yeah.
And connect those dots. But I ended up having relapse from the first palate expander. So then I had another palate expander when I was 12.
Okay.
Um,
Yeah. Which
and
makes
then,
sense. I mean, if your mouth is open and your tongue is down, that
yeah,
expander can come out, but if your tongue doesn't go fill the place, then of course there's going to be relapse. So,
exactly, exactly. And then unfortunately, I had 4 teeth removed before I had braces put on.
mm,
Um, had braces for 2 years and ended up with really nice straight looking teeth. But the orthodontist said, you know what, this is as good as the bite is going to get. We can't get those teeth to come together in the front. You'll probably have to wait till you're older and you finish growing, and then you'll need surgery.
like jaw
So
surgery.
jaw surgery, yeah,
Wow. Okay.
yeah. So
How old would you have been then? I mean, were your parents like, what's going on? Like, you-
um, so I guess I was like 14 when I got my braces off.
you're just told, well,
And
you need jaw surgery when you're 18 or however old.
yeah, like 18, 19, come back and we'll do braces and jaw surgery. Um, so I think I waited until maybe I was about 22 and then thought, and I was working in the dental hygiene field then at that time. And I thought,
Okay.
I think I'm gonna do it. I think I'm gonna go back and have
Yeah.
this jaw surgery. My open bite was really bothering me just because it, not visually, but it was just really hard to eat.
Yeah.
I couldn't
People
bite
don't
into
realize.
anything.
Yeah, exactly. It's uncomfortable chewing and
Yeah,
biting into things. It's not easy.
yeah. So I went. I actually saw an oral surgeon first to talk about the jaw surgery, and they said, yeah, you're a good candidate. Open bite surgery has great success. The sad thing is that you probably need an expander again and braces again.
So
So
did they have a name for the surgery? Was it like Lafort or like what did they what
yeah,
or was it MMA, like both mandibular and maxillary advancement, or what were they talking
it
about?
I feel like it was called a Lafort 1
Mm.
orthognathic surgery. It was only maxillary. I think it was like a maxillary impaction and advancement, but I didn't have anything done with the mandible.
Interesting. Okay.
So it was only the maxilla. Um, Before I had that, I had a surgical rapid palate expander, so an
Mm.
SRP,
Mhm.
braces for a year, and then my jaw surgery. Um, and actually, I was so pleased with the result from the surgery.
Good.
My teeth finally, for the first time in my life, all came together. It was a really weird feeling, but it was beautiful. Um, I had the braces on, I think, for another 6 months after that and had them removed, had retainers and everything. But then, unfortunately, 6 months to a year later, I noticed that my teeth, I couldn't get my front teeth to touch together again.
Oh,
And
I see.
I was discouraged and I went back
Yeah.
to the orthodontist, and they couldn't really figure it out at that
And
time.
relapse is so common if you don't correct the tongue and the breathing, right?
It
And
is, it is. And unfortunately, at that point, I still had not corrected the tongue and the breathing.
did you
So
have any progress with allergies or with figuring out like maybe root causes of why you couldn't breathe? Like had you worked through that as an
I,
adult at all?
I still hadn't really, no, I wasn't really
Okay.
at the point yet where I had
Mhm.
thought of my breathing as being a problem.
It's so I noticed a lot of people, it's just kind of like that's how I am. Like people don't
Yeah,
even question that they don't breathe.
Yeah,
And I don't know why. It's just, I think when you've lived your whole life that way, you don't realize that it's a problem. So,
exactly. I think that's probably
mhm.
where I was too. And I would hear um, other people talking about the breathing, and you kind of hear, oh, well, some people just breathe through their mouth. That's normal. And now we know that it's very common, but it's never normal.
Yeah, it's definitely not healthy. So,
Yeah, yeah. So anyway, I was kind of at a point in my life where I wasn't going to be too worried about my orthodontic relapse. I met my husband, like what we got married, had kids. That was kind of my focus for a while. Um,
you
and
just were
then
like,
kind
well,
of,
my bite's not perfect, but oh well, I've done
yeah,
everything I can. Yeah.
yeah. Flash forward about 10 years after that, um, all of a sudden I started, well, maybe not all of a sudden, but I started developing chronic headaches and jaw pain. And that was where I started looking for more answers. And um, the more that I looked, the more I kept coming across mouth breathing issues and open mouth. And I thought, wow, I think that's me. I think I check off a lot of these boxes. What do I do for it now? I know that
Yeah.
this is a problem. I ended up going back and seeing the orthodontist and oral surgeon again, to have a look at the relapse. They were still quite surprised that I had had so much relapse.
I'm surprised that they're surprised, like,
I know it. I mean, you only know what you know.
yeah,
So I
it's
feel
true.
like probably there's so many people that I bet have relapse after surgery and relapse after orthodontics and just
They never
live
go
with it
back.
and never go back.
Yeah.
So, you know, not it's not really the orthodontist's fault because they don't know that those
No,
patients had
it's
relapse
not.
and
And
never come
I would
back.
say, if anything, patients always feel like it's their fault too. They're like, oh, I didn't wear my retainer. And
Yeah.
so it's really no one's fault. It's just, this is the state of the treatment, and we just haven't
Hmm.
really understood it fully. So, it's too bad that it happens, but it's definitely common.
Yeah. Yeah. Definitely common. And now I've seen that so much in my practice.
Yep.
So
Yeah.
many relapsed orthodontic cases and even a few relapsed surgical cases too. So
Yeah.
um, I think the most discouraging thing for me was that when I finally did go back that 10 years later to ask about the relapse, I was kind of made to feel like it never happens, that
Mm.
there was just something wrong with me because that never happens. Um, so because I was so discouraged, I just thought, you know what, I'm going to just totally figure this out on my own. And I went to Google because that's what we do,
Yeah.
and started Googling open bite relapse, jaw surgery relapse, orthodontic relapse.
Wow. I'm
Uh,
glad you did.
I'm so glad that I did. It honestly, it changed my career, changed my life.
Yeah. How
Uh,
many years ago would you say that was? Was that like 2017? Like, that's
that
about
was
the time you got in touch
before
with me.
that. So
Before. Okay.
yeah, that was, I would say probably like 2015 or 16 that I started maybe making those connections. And then probably, yeah, towards the end of 2016 is when I really started to focus more on it because now I was starting to feel like I had answers.
Mm.
Um, but then I needed to find a solution. So initially I thought to myself, well, maybe I'll find somebody to help me correct my mouth breathing. Maybe I'll find a myofunctional therapist. And I couldn't find anybody. There was nobody.
No.
Um, Within like a
No.
2 hour drive of me at least. And at that, I think there was maybe only one or two
Mm.
people. So then I thought, I wonder how somebody can do myofunctional therapy. I wonder what's involved with that. Um, so Googled a little bit more and found that dental hygienists can do myofunctional therapy. It's within our scope. So that was just kind of this huge aha light bulb
Yeah.
moment for me. I connected so many dots and realized, you know what? I'm going to be a myofunctional therapist. I don't care what it takes. I'm going to do it. Maybe at very least, I'll be able to help myself with my
Yeah.
problem. At the most, and what I'm so thankful that I can do now is help so many other people with their problems.
Yeah. Like, give me goosebumps. That's good. I
Oh,
know.
thanks.
Yeah.
um, and like most importantly, help the kids and recognize all of those early warning signs.
Yeah. Because they're there. I mean, all the
Yeah,
signs were there when you were a kid, you know? They
for
didn't
sure.
disappear as an adult who needs jaw surgery, you know?
Yeah.
It's so predictable and detectable early if we just know what to look for.
Oh, yeah, for sure. And I would never want anybody to have to go through what I've gone through. So if I can see kids early and help correct their myofunctional disorders, and maybe they'll still need braces, but hopefully they won't have the relapse, and hopefully they won't grow up becoming a chronic pain
Yeah.
patient as well, and have those jaw pain headache things. So
Yeah, so loop back, where did you so you did the research, you said I'm gonna get trained, and then what was
yeah,
your next step?
sorry, what was that?
You did all the research, you said I'm gonna be a therapist.
Oh,
And
yeah.
what happened from there?
Well, then I started looking at courses and found your course. So it just fits so perfectly with what I needed at that time. I needed something that allowed me to take in little bits of information at a slow pace and apply those things that I was learning.
I love
Um, because I did look at some of the other 4-day courses as well, but I just knew for myself, if I go do one of these 4-day courses, I'll have all this information, but I'll have no idea what to do with it.
Yeah,
So that
it's a
was
good
what
way to
was,
start because I know you've since taken one of the 4-day courses.
yeah, I mean, I've taken a
A
whole
lot.
bunch of courses since too,
Yeah,
because you kind of, I feel like we all get into that where we just need to know
yeah,
more. It just
just want
makes
to
so
learn.
much sense that you can never get enough information.
Yeah,
Um, but yeah, that was kind of what I found. And then I'm really happy to say that I did correct my mouth breathing. I realized that I can actually breathe through my nose quite well. I have no
good.
issues there. Um, Realized I had a tongue tie, so I had that corrected as well. Um, and have really solved a lot of my, actually almost all of my headaches, jaw pain.
Good.
I just don't get that anymore. So I,
Have you noticed changes in your sleep? I mean, this is something for me. I never thought that I was a bad sleeper until I started actually breathing through my nose at night. And I was like, I sleep
yeah,
so much better.
I do sleep so much better now, actually. Yeah. Um, Most of the time, I'll still tape my lips for sleeping. Um, but it just feels very strange to me now to have to breathe through my mouth.
Yeah.
Um, and I used to kind of make fun of my husband when he would tell me when he had a cold, and he would say, I can't breathe. And I would just say, breathe through your mouth. And he would say, no, I can't do that.
So
And,
uncomfortable. Yeah.
but now I understand, because when you have a cold then and can't breathe through your nose, it's so frustrating.
It's so uncomfortable. It's like the
It is.
worst feeling when you have to revert to that. It's just like, oh, I hate this, you know? So
I know. I know. So yeah, I do sleep so much better now
good.
breathing through my nose.
I love your story because you've come so full circle, like, childhood, ortho, surgery, pain, and it is the progression of the adult patients that we see.
It
And
really is.
then to be able to like solve all that, transform your career at the same time, because I know you've got a great successful practice going on there in Waterloo, and you're helping a ton of people. And I know you helped your son. He went through the whole tongue tie surgery along with you, which I don't know if you want to talk about that, but you can if you want.
Sure. He's also like a lot of the kids that I see in my practice too, which I really feel my own experience and going through my son's experience too really makes me a better therapist, because I
Sure.
can completely relate to all of my patients' issues that they're having. And going through the therapy myself and with my son, I know what you're in for, having to go through that therapy and having to change your breathing because it's not easy.
No.
But he also checked off a lot of the boxes. Had a very severe tongue tie that wasn't caught when he was a baby. So we did have that corrected when he was just over 5 years old.
Yeah.
And
Which I
then
know from the mom perspective, I remember going through that with you, and it's been a few years now, 3 years, or he's got to be like 8 or 9 now, right?
yeah, he's almost 9. Yeah.
Yeah. So, I mean, I remember being like, oh, it's such a tough age because when you're 5, like you want to do what your parents say, but it hurts and it's so
Yeah.
hard. I remember just seeing you and I was like, oh man, it's so hard as a mom when you like, it's what needs to be done, but like your little baby's in pain, you know?
I know. It was tough. I would say like way tougher to have him go through the procedure than myself. Because as a parent, you don't want to see your kids in pain. But it really wasn't that bad. And
Yeah.
um,
He did really well. I
yeah,
mean,
he
I
doesn't
remember,
really even remember anything about it
and you got
either.
him to do the exercises so well. I remember meeting with you guys on Skype or whatever at the
Yeah.
time, and he was such a little like trooper. I mean, he did everything you asked like to the T. He was an amazing patient. So he did great.
Thanks. Thanks. So yeah, and I mean his correcting his tongue tie and doing some therapy with him solved a lot. But unfortunately he did still have enlarged tonsils and adenoids and had some childhood sleep apnea. So a few years ago we did need to have his tonsils and adenoids removed. Um, and then have been just really working with his breathing. So his breathing is much, much better. He sleeps really great now. A totally different kid as well. His whole personality and behavior is so much better. He's definitely in for an orthodontic path as well, but
At least you know
you
these
know,
things now. Yeah.
exactly. Yeah, yeah.
Good. Well, like I said, I love your story and I love that now you're able to help your son too, because guiding that growth from a young age, if he can get that, then he can avoid surgery and pain and all that
Mm-hmm.
stuff down the road that you've gone through. So, yeah, thank you for doing this. I mean, I'm so glad that you tell your story to your patients because I know that a lot of us in the dental field, like we don't necessarily want to talk about our personal stuff. I find
Mm-hmm.
that so many therapists, and I should say myofunctional therapists. So many of us, I think we kind of hold back in the beginning when we're new, especially. But I think the more you actually tell it, the more patients connect with that. And like you said, you've gone through it yourself and with your son. So like what the parents are in for, what you're in for. Like I think it can only help to tell these things to your patients. It can only help them be more successful and understand why they need it, and why you care so much.
Yeah.
you know
Thank you. Yeah, I just really love the campaign that you're doing, and I hope that it just brings so much more awareness to mouth breathing not being a normal thing. It needs to be solved. The sooner the better.
yeah, no, it's great doing it. And so thank you. Is there anything anyone you want to give a shout out to? Any last things you want to say, or should we just wrap it up?
Um, yeah, I mean, uh, if we're gonna give shout outs, I will give a little shout out to an awesome dentist and orthodontic provider that I work with. A couple actually, but
Yeah, go for it.
Dr. Mandeep Johal is in Guelph, Ontario. She is doing some amazing early orthodontic intervention for kids.
Cool.
Um, Also does some great work with adults as well, and awesome tongue tie releases.
Good.
Um, so definitely want to shout out her. And I'll give a quick shout out to Wilk and Wilk Orthodontics as well. Also doing lots of great orthodontics for kids, teens, and adults.
Good. Yeah, no, I think we've got to kind of share the providers and the people who are actually on the same wavelength because it's not mainstream. I mean, these ideas, these things that we're talking about, I would say 99% of dentists and orthodontists and hygienists don't know these things. So,
Mm.
and that's not, like we said before, it's not anyone's fault. It's just the state of our healthcare and dentistry, and that's changing, right? And
Yeah.
hopefully things like this will help it change even more. So that's why we're here. So. All
Okay.
right. Well, thank you so much, Kim. I guess we'll just sign off and say goodbye, but I really appreciate you sharing your story for mouth breathing awareness. So,
Okay.
okay.
You're welcome. Thanks for
Yeah,
having me.
you're welcome. I'll talk with you later.
Bye.